انتوا ليش وقت راح تداومون؟ الاسبوع الجاي راح تداومون ولا لا؟
والله دكتور يعني الاسبوع الجاي عندنا امتحان بس الحدث لا جدول نازل لا محددين المواضيع ما ندري يعني صراحه.
هم قالوا شو اسمه، قالوا على اساس قدموها الامتحانات.
دكتور احنا بس 3 نمتحن عملي.
شلون الامتحان العملي؟ يبدي يوم 6/7 يعني بعد 3 ايام.
اي دكتور، وهسه صاير فوق هوسه صاير تقارير وامتحانات.
لا مواضيع.
ايه دوكي زين، لا هذا الاسبوع اذا باقي الاسبوع الجاي نشوف. اكيد ما راح
اي زين دكتور، على مود نتفق على محاضرات الفاينل.
ايه هاي اخر محاضره اليوم وهذا هو.
تمام دكتور، بل من ناحيه المحاضره حتى نتفق عليهم.
شلون؟
من ناحيه المحاضره حتى نتفق على محاضرات الفاينل، كم محاضره تدخل وشلون النمط.
كل شيء يدخل، شنو كم محاضره تدخل هذا حكي هذا. Okay, you will start now. You will complete the cranial nerves. Last week you have studied the facial nerve. Now what is left are the five last cranial nerves. You will start with the 8th nerve, the vestibulocochlear nerve. The vestibulocochlear nerve is written as V with 3 eyes. Is again a single component nerve containing only sensory component, which is a special somatic afferent. Because this nerve is responsible for hearing and equilibrium. That stimuli comes from the environment. You hear sounds, these are in the air and then come to the internal ear to the vestibulocochlear nerve, from there pass to the nerve. So it's a special somatic afferent responsible for sense of hearing and equilibrium. This arises from the vestibular and cochlear nuclei in the brainstem. We have seen that we have 4 cochlear and 2 vestibular nuclei. It emerges at olivopontine junction, at the junction between olive of the medulla oblongata and the pons, together with the facial nerve. Both of them, they leave cranial cavity with the facial by entering through the internal acoustic meatus, and then enters inside the petrous part of temporal bone to terminate on the organ of hearing, that is the cochlea, and equilibrium, which is the vestibular apparatus of internal ear. So it's a very short nerve, immediately emerging from the junction of olive and pons, pass through the internal acoustic meatus to reach to the inner ear, ends in the organ of corti, and the vestibular apparatus of the inner ear. Injury of it leads to deafness. That is loss of sense of hearing. So, as I have a very short course nerve, has no branch, it's only a single component nerve, special somatic afferent for hearing. So, starts from organ of hearing in the internal ear, pass through the internal acoustic canal, emerge through internal acoustic meatus, and terminate in the brain by passing between the olive and the olive of medulla oblongata and pons to terminate in vestibular and cochlear nuclei, because the sensory nerve. Hearing sound waves pass to the auricle and external auditory meatus, then hit the tympanic membrane. This leads to movement of the ossicles of middle ear. This leads to movement of secondary tympanic membrane, and then fluid in the membranous labyrinth moves, lead to stimulation of sensory nerve endings of vestibulocochlear nerve, and then in the brain is interpreted, the sound is interpreted. So this is for the vestibulocochlear nerve. Now next we have the Glossopharyngeal nerve, which is the ninth cranial nerve. The Glossopharyngeal nerve, again, is like facial nerve. The Glossopharyngeal is like facial. It has 4 components. It contains general somatic afferents, that is sensory for the middle ear cavity. Contains special somatic efferent for the supply of muscles of 3rd pharyngeal arch. Contains taste sensations, if you remember from the tongue, it supplies posterior 1/3 of the tongue with sensory and taste buds of the posterior 1/3. So it contains special visceral afferent, just like the facial, and contains special visceral efferent fibers These are preganglionic parasympathetic ganglia for the otic ganglia in the infratemporal fossa, which supplies the parotid gland. So it has four components: two motor, special somatic efferent for the muscles of third pharyngeal arch, special visceral efferent preganglionic parasympathetic for otic ganglia, contains special visceral efferent fibers, test fibers from posterior 1/3 of the tongue, and contains general somatic afferent fibers, general sensations from the middle ear and posterior 1/3 of the tongue. So this takes origin from the inferior salivatory nucleus, which is preganglionic parasympathetic, from the dorsal motor nucleus of vagus, and also from the trigeminal sensory nucleus and the test fibers from gustatory nucleus. Four components, these become collected in one nerve. The fibers become enclosed by one sheath, and then emerge between pyramid and olive of medulla oblongata, above the origin of the vagus nerve, and then leaves the cranial cavity through the jugular foramen, accompanied with the vagus and the accessory with internal jugular vein. It enters here in the posterior wall of the pharynx. Here, this is the glossopharyngeal nerve. In the upper part is in the carotid sheath, and then leaves the carotid sheath. Here are the jugular foramen. It has two sensory ganglia for the relay of sensory fibers, superior and inferior glossopharyngeal ganglia. Then it descends between superior and middle constrictors. You see here, emerging from there, it passes in the gap between the superior and middle constrictor muscles of the pharynx. We have studied this with the pharynx. Now, the four components of it, before it emerges there, it gives rise to a tympanic branch. This is again the nerve, gives rise to a tympanic branch which passes inside the middle ear cavity, where it spreads on the promontory of middle ear, supplying the middle ear cavity. This branch to middle ear takes with it also preganglionic parasympathetic fibers. These preganglionic parasympathetic fibers, they leave the middle ear cavity through the hiatus in the anterior surface of the petrous part of temporal bone, entering in the middle cranial fossa, and then leaves the middle cranial fossa with the mandibular nerve to end in the otic ganglia, supplying the otic ganglia with preganglionic parasympathetic fibers. From the otic ganglia, postganglionic parasympathetic fibers pass with the auriculotemporal nerve, and then leaves the auriculotemporal nerve as it passes in parotid. They supply postganglionic parasympathetic fibers for the parotid, which is secretomotor for the parotid gland. Just like the facial, we are seeing the greater petrosal supplies pterygopalatine ganglia. His lesser petrosal nerve supplies otic ganglia. So two components, we have finished with them. What remains are the test fibers. The test fibers with some sensory fibers and the special somatic efferent fibers. The motor fibers of it, the special somatic, as it passes in the gap between superior and middle constrictors, it usually accompanies the stylopharynges. These two structures pass in the gap between superior and middle constrictors. It supplies the stylopharyngeus muscle. This is the only muscle derived from the third pharyngeal arch. The sensory part of it supplies then the mucosa of the pharynx, and then the rest of it descends to the posterior through the pharyngeal wall. It descends to sensory to the pharynx, and to the tonsils, and then it supplies the posterior 1/3 of the tongue. Its lingual branch supplies sensory and test fibers for the posterior 1/3 of the tongue. You remember we have studied this with the tongue. So this is for the glossopharyngeal nerve. Again, the glossopharyngeal nerve has 4 components: general somatic afferent, middle ear cavity, and the walls of the pharynx and posterior 1/3 of the tongue. Special visceral afferent, test fibers for the posterior 1/3 of the tongue. Special somatic efferent for the muscles of 3rd pharyngeal arch, which is only single muscle derived from this arch, which is the Stylopharynges. And then special visceral efferent. These are preganglionic parasympathetic fibers for the otic ganglia. So it arises from inferior salivatory nucleus, dorsal motor nucleus of vagus, trigeminal sensory nucleus, and gustatory nucleus. Emerges between the pyramid and olive of medulla oblongata to leave the cranial cavity through the jugular foramen, enters carotid sheath to pass to superior and inferior glossopharyngeal sensory ganglia. Then it descends between superior and middle constrictors of the pharynx. It passes through the tonsillar bed and then ends by plunging into mucosa of posterior 1/3 of the tongue. It gives rise to tympanic branch, which enters middle ear to form tympanic plexus on promontory, supplying sensory for middle ear, and then from it emerges from the tympanic branch, from this plexus, emerge lesser petrosal nerve, which leaves middle ear cavity through lesser petrosal foramen in the anterior wall of the petrous part of temporal bone to enter middle cranial fossa, and then leaves it through foramen ovale, accompanying the mandibular nerve to end in the otic ganglia in the infratemporal fossa, which supplies parasympathetic nerve to the parotid gland. The postganglionic passes with the auriculotemporal branch of mandibular as it passes in the parotid and then leaves it to supply the parotid gland. It gives a carotid branch to the carotid sinus. This is responsible for checking of the blood pressure. Nerve to stylopharynges. This is for the only muscle derived from the 3rd pharyngeal arch. Pharyngeal branch to the sensory to the pharynx, sensory to the tonsils, and then the lingual branch, that's for the tongue. This is sensory for the posterior 1/3 and test fibers to the posterior 1/3 of the tongue. So this is for the glossopharyngeal nerve. Now we pass to the 10th nerve, the vagus nerve. Now the vagus nerve is just like the facial nerve. Again, the vagus nerve has 5 components, like the facial. It has general somatic afferent, that is sensory from the auditory meatus and part of the auricle with external auditory meatus. It has test fibers from the anterior surface of the epiglottis, that is special visceral afferent with general somatic afferent. Then it carries sensations from the viscera, that is from the walls of the oropharynx, from the esophagus down to the stomach and intestine, and the trachea, bronchi, and lungs. These are visceral sensations, not somatic, visceral sensations from the viscera. You feel pain in the esophagus, you feel pain in the stomach, in the intestine. These we call them general visceral afferent. So 3 sensory components are present in it: general somatic afferent, special visceral afferent test fibers, and general visceral afferent sensory from the viscera. In addition, contains special somatic efferent for the supply of muscles derived from the 4th pharyngeal arch and 6th pharyngeal arch. So from 2 arch supply 2 muscles derived from 2 arch, 4th and 6th pharyngeal arch. Contains also special visceral efferent fibers, that is preganglionic parasympathetic fibers for the parasympathetic ganglia in the walls of the oropharynx, pharynx, laryngopharynx, larynx, trachea, bronchi, lungs, esophagus, till stomach, intestine, till the right 2/3 of the large of the transverse colon. So it has 5 components, so arise from 5 nuclei. It takes origin from main sensory nucleus of trigeminal nerve. It takes from the gustatory nucleus, from dorsal motor nucleus of vagus, and from nucleus solitarius for the general visceral afferents. From all these nuclei, the nerve then emerges between the olive and the pyramid of medulla oblongata below the glossopharyngeal. The rootlets of it descend and leaves the cranial cavity through the jugular foramen. Here is the cranial nerve, the vagus nerve. And all this is the vagus nerve. It's called vagus بالعربي تايه متيه rumbo, because it has a very long course. Since it is a cranial nerve, you have seen that all of them, the previous 9, they end in the head and neck, but this is the only one which leaves the neck to enter into the thorax and in the abdomen. So it leaves the cranial cavity through the jugular foramen, accompanied by glossopharyngeal, hypoglossal, and the anterior jugular. Then here it becomes accompanied also by the cranial part of accessory nerve. The cranial part of accessory nerve, this is the 11, accompanies it. And here sometimes it's called vago-accessory complex, because the cranial part of it distributes with the vagus, as it is part of the vagus nerve. Now the vagus, then leaving the cranial cavity through the jugular foramen, it terminates again in sensory ganglia here, where the sensory fibers rely on the ganglia, and then within the carotid sheath, it continues in the carotid sheath. You see here through the carotid sheath till the base of the neck, accompanied by the internal carotid upward with the internal jugular vein. It lies between and behind them, between and posterior. Here is the internal carotid, and then with the common carotid entering into the neck, through the neck, leaves the neck, pass into superior mediastinum. Sorry. In the superior mediastinum, it descends downward into the thorax, where leaves the superior mediastinum to the root of the lung. At the root of the lung, it breaks into pulmonary plexus. From there, it becomes collected as 2 vagal trunks. One pass anterior, the left one pass anterior, the right one pass posterior to the esophagus. Descend with the esophagus through the esophageal orifice of diaphragm to pass into the anterior and posterior walls of the stomach, and from there pass to the superior mesenteric ganglia, supplying, then it pass through the nerves accompanying the branch along the branch of the celiac trunk toward the supply, the stomach, the duodenum, the jejunum, the ileum, the appendix, cecum, ascending colon, and right 2/3 of descending colon. So it has a very long course. Very long course through the abdomen. We have nothing to do with that. In the neck, it gives rise to a number of branches. The vagus nerve gives rise to a sensory meningeal branch for the supply of the dura mater of the posterior cranial fossa. As I said, it gives sensory to the medulla, to the external ear, to the auricle and the external auditory meatus. Auricular branch, sensory to external and tympanic membrane. It gives branch to the pharyngeal branch. These muscles supply all muscles of the constrictors of the pharynx with the salpingopharyngeus and stylopharyngeus muscle, except the stylopharyngeus. It supplies all the 5 muscles of the pharynx, supplies the 4 muscles of soft palate also, with the supply of soft palate, except the tensor villi palatini muscle, which is supplied by mandibular nerve, and the Stylopharynges, which is supplied by the Glossopharyngeal nerve. So it supplies three constrictors and Salpingopharyngeus with the palatopharyngeus muscle, and supplying the other muscles of soft palate, the levator villi palatini, the tensor, the brevator villi palatoglossus, and palatopharyngeus with the musculus uvuli, except the tensor villi palatini muscle, which is supplied by mandibular nerve. Then in the neck, it gives rise to carotid branch, which is again a baroreceptor and chemoreceptor to the carotid sinus in the junction of the division of the common carotid artery. In the neck, it gives rise also to superior laryngeal nerve. The superior laryngeal nerve here passes to the lateral side of the above the inferior constrictor muscle. It divides into two branches, into internal laryngeal, which pass deep to the inside the larynx, supplying all intrinsic muscles of the larynx except the cricothyroid. Then it gives rise to external laryngeal nerve, which descends lateral to this inferior constrictor and supplies the cricothyroid muscle. So this superior laryngeal supplies all intrinsic muscles of the larynx through two branches, internal laryngeal and external laryngeal. External laryngeal supplies only cricothyroid. The rest is supplies the all other muscles of the larynx. In addition, this contains preganglionic parasympathetic for the intramural ganglia of the larynx, and contains also general visceral afferent fibers from sensations from the larynx. Now, within the neck, in addition to this, it gives rise to cardiac branch. It gives to a superior and inferior cardiac branch, which are not shown here. This is the cut edge of the lower or inferior cardiac branch. This is a superior cardiac branch. These, they pass to the thorax. They supply the sinoatrial node of the heart. Cardiac branch, they are preganglionic parasympathetic for the sinoatrial node, where this decreases the heart rate. And then it descends in the neck. It gives rise to recurrent laryngeal nerve. The right recurrent laryngeal nerve arises in the neck, emerge below the subclavian artery, and ascend back to enter into the inferior aspect below the inferior constrictor. Here, the recurrent ascend upward between the esophagus and the trachea and pass upward to inside the larynx. The larynx supplying the muscles of the larynx. On the left side, the left recurrent laryngeal, it emerges in the thorax below the arch of the aorta and pass below the ligamentum arteriosum, and then ascend upward between the trachea and the esophagus and pass to enter inside the larynx, supplying again muscles of the larynx. So the vagus through the superior laryngeal and recurrent laryngeal on each side supplies all muscles of the larynx, supplies sensory for the larynx, supplies preganglionic parasympathetic for the larynx, where the ganglia are situated in the wall of the larynx. External superior laryngeal divide into two, internal laryngeal and external laryngeal. External laryngeal supplies cricothyroid, is only motor, while internal laryngeal is sympathetic, is sensory and parasympathetic. The recurrent laryngeal is motor in addition to sensory and preganglionic parasympathetic fibers. Then descends in the lung. Pulmonary plexus gives rise to pulmonary branch for the supply of the lung, again preganglionic parasympathetic and sensory general visceral afferent. Supplies also the sinoatrial node through the cardiac branch, and then descend into the esophagus, supplying it. Abdominal supplies the stomach, as I said, duodenum, ileum, appendix, cecum, ascending, and right 2/3 of transverse colon, supplying them with preganglionic parasympathetic, and motor for the smooth muscles, that is preganglionic parasympathetic, where they terminate into parasympathetic ganglia. Then postganglionic supply smooth muscles and glands of the intestine. These are excitatory. They lead to increased peristalsis of the muscles of the stomach and all the GI tract, and increase the secretion of the gland, secretion of enzymes, so aids in digestion. These collectively are abdominal nerves. So again, the vagus, because it arises from the brain and descend inside the abdomen. The only one of cranial nerves which behaves like that. And that's why it's called vagus nerve. 5 components, as I said: general somatic afferent, some general sensations from the auricle, auditory external, auditory meatus and tympanic membrane; general visceral afferent, sensations from the viscera, starting from the pharynx, larynx, trachea, bronchi, lungs, intestine, esophagus, stomach, and small intestine and part of large intestine. Contains special visceral efferent fibers for these are preganglionic parasympathetic ganglia for the parasympathetic ganglia in the walls of these viscera. Contains special somatic efferent fibers for the supply of muscles derived from the 4th and 6th pharyngeal arches. These 2 arches, they give rise to the constrictors of the pharynx together with the all muscles, intrinsic muscles of the larynx. Arises so from trigeminal sensory nucleus for general somatic afferent, nucleus solitarius for general visceral afferent, gustatory nucleus for special visceral afferent, dorsal motor nucleus of vagus for special visceral efferent, and nucleus ambiguous for the special somatic efferent. Rootlets emerge from medulla oblongata between olive and tuber cinereum below the glossopharyngeal, leaves cranial cavity through jugular foramen to the base of the skull, through vagal ganglia, and then enter into carotid sheath between internal carotid and internal jugular vein, descend through it to enter superior mediastinum in the thorax, descend to anterior to the arch of the aorta to break at the root of the lung, forming pulmonary plexus. Leaving from there, become collected to join its fellow, then form esophageal plexus, and these descend on anterior and posterior wall of the vagus. Now we call them anterior and posterior vagal trunks. They are anterior is the left and posterior is the right vagus. Then pass to the anterior and posterior walls of the stomach to the celiac and superior mesenteric plexus. From there, it spreads to supply all the parts of the intestine. Branch of it gives meningeal for the supply, sensory for the dura mater, auricular branch, sensory again to the auricle and external auditory meatus and tympanic membrane. Pharyngeal branch, muscular to all muscles of the pharynx, and soft palate, except, as I said, Stylopharynges, which you have seen is supplied by Glossopharyngeal Nerve, and tensor villi palatini of the soft palate supplied by mandibular nerve. Carotid branch in the neck, sensory to carotid sinus at the junction of the division of the common carotid into internal and external. Superior laryngeal to the larynx, divide into external laryngeal to supply cricothyroid, internal laryngeal, and supply sensory and parasympathetic till the vocal cords. Then it gives rise to recurrent laryngeal. Left one arises from the thorax below the ligamentum arteriosum, and right one below the right subclavian in the neck. They ascend to larynx, supplying all muscles of larynx and sensory and parasympathetic to larynx below vocal cords. Cardiac branch, 2 parasympathetic, superior and inferior cardiac branch, arise in neck and descend to enter the sinoatrial net of the heart. Pulmonary at the root of the lung, sensory and parasympathetic for the lungs. Esophageal for the sensory, motor, and parasympathetic for the esophagus. And then abdominal, sensory, motor, that's general, visceral, and parasympathetic for the gastrointestinal tract till right 2/3 of the transverse column. This is the vagus nerve. Now next we have the 11th cranial nerve, XI, accessory nerve. From its name, accessory, it means accessoirat, so it's something which is extra. It's an accessory nerve. It's not. This is because this arises from nucleus ambiguous, which is cranial part of it, and this joins vagus nerve, forming vago-accessory complex, and it distributes with the vagus. And that's why it's called accessory. So just emerges and fuses with the vagus in the same sheet and distributes with it, forming what we call it vago-accessory complex. So it shares in the supply of all these areas. Another origin of it arises from 4 accessory nuclei in the spinal cord, in the upper 4 cervical spinal segments. This is called spinal root. These spinal root ascend upward through the foramen magnum into the cranial cavity and joins the cranial nerve, the cranial root which emerges from medulla oblongata. This joins vagus nerve, and spinal root from spinal cord ascend to intercranial cavity and leaves it through jugular foramen to enter in the posterior compartment of the neck. This spinal part only supplies 2 muscles, trapezius and sternocleidomastoid muscles of the neck. Now here is the accessory nerve. It emerges 2 parts. Cranial part is as it is part of the vagus nerve because it immediately joins the vagus nerve, forming vago-accessory complex. The spinal root of it arises from upper 4 cervical spinal segments, ascend upward, enters through the foramen magnum into cranial cavity, and then descends with the vagus, emerge through the jugular foramen, and then the spinal root of it leaves it and leaves the carotid sheath and enters in the posterior triangle of the neck. This is the accessory nerve. This is the sternocleidomastoid. It supplies the sternocleidomastoid of the neck, which lies in the middle of the neck, dividing it into anterior and posterior triangles, and then pass through the posterior triangle to terminate on the deep surface of trapezius muscle. So the accessory nerves, cranial part joins with the vagus, spinal part supplies only two muscles, which is the sternocleidomastoid of the neck and trapezius on the back of the neck. Accessory nerve, so arise from nucleus ambiguous. This is the cranial part of it, joins vagus, forming vago-accessory complex. Spinal part from accessory nuclei, 4 accessory nuclei in the upper 4 cervical spinal segments. This is the spinal root. These 4 roots emerge from spinal cord and ascend to enter the cranial cavity through foramen magnum and leaves it through join with the vagus. The cranial part emerges from medulla oblongata. The 2 with the vagus nerve, they leave cranial cavity through the jugular foramen. The cranial part enters into the vagus, forming vago-accessory complex. The spinal part leaves the carotid sheath and enters in posterior triangle of the neck, supplying the sternocleidomastoid, and enters in posterior triangle, pass downward to supply the trapezius muscle. So it only supplies trapezius and sternocleidomastoid muscles. Now finally we have the 12th cranial nerve, XII. This is the hypoglossal nerve. From its name, hypoglossal, it means below the tongue. Hypoglossal nerve is again a single nerve, single component nerve. It's just like those oculogyric nerves, the trochlear and the abducens nerve. It has only single motor component, which is general somatic efferent, supplying ordinary skeletal muscle fibers. Is a pure motor nerve, like the trochlear and the abducens nerves. It arises from the hypoglossal nucleus from the hypoglossal nucleus in the brainstem, in the medulla oblongata, and then leaves the cranial cavity just lateral to the pyramid. Then it enters through the hypoglossal canal, leaving the cranial cavity through the hypoglossal canal, enters in the carotid sheath, and then it leaves the carotid sheath as it reaches the carotid triangle. Then descends above, passes above the above the hyoid bone and superficial to the hyoglossus muscle, and then enters to the inferior surface of the tongue, spreading to the tongue. The hypoglossal nerve is the sole motor supply for all intrinsic and extrinsic muscles of the tongue, except the palatoglossus, which is a muscle of soft palate. So it supplies styloglossus, hyoglossus, genioglossus, and supplies all intrinsic muscles, the superior, inferior, longitudinal, transverse, and vertical muscles of the intrinsic muscles of the tongue. Now the hypoglossal nerve is this course, single component only, single component, and pass to supply muscles of the tongue. But through its course, as it passes in the upper part of carotid triangle, is joined by a branch from first cervical ventral ramus of first cervical spinal nerve. From first cervical joins the hypoglossal nerve. This joins, has nothing to do with the hypoglossal, but joins the hypoglossal nerve as a motor nerve, motor component, joins the hypoglossal in the carotid sheath. Portion of these nerves continue with it, and then leaves it as it reaches to the submandibular region. It leaves it for the supply of thyrohyoid muscle. Is nerve to thyrohyoid. Some of the fibers again continue with it and then leaves it to supply the geniohyoid muscles. These two muscles, the geniohyoid and thyrohyoid, these two are supplied by the first cervical spinal nerve, but this nerve cannot come by itself. It joins with the hypoglossal. As it reaches to its destination, leaves the hypoglossal, supply the thyrohyoid, and then the other fibers, leaves it before it passes below the tongue to supply the geniohyoid. Again, some of the fibers from C1, they descend in the carotid sheath anterior to the common carotid, and join with other branches from C2 and C3. They form a loop of nerves. This loop is called ansa cervicalis. This portion of C1, we call it superior root of ansa cervicalis, and the posterior one, which comes from C2, C3, is called the inferior root of ansa cervicalis. The two, they form a loop. Ansa, it means loop, قوس. The loop is on. This is called ansa cervicalis. From this ansa, they supply the rest of infrahyoid muscles. They supply the omohyoid, the sternohyoid, and sternothyroid muscles, the strip muscles from the hyoid bone. The thyrohyoid is supplied by C1 with the geniohyoid. So all these, they have nothing to do with the hypoglossal, but they accompany it, and then to reach to their destination for the supply of supra and infrahyoid muscle. But the hypoglossal by itself supplies only the muscles of the tongue, all the muscles of the tongue except the palatoglossus muscle. So the hypoglossal nerve, single component, general somatic efferent, supplying ordinary musculoskeletal muscle fibers, is a pure motor supply for the tongue, arising from hypoglossal nucleus in medulla oblongata, emerge lateral to pyramid, leaves cranial cavity through hypoglossal canal to enter carotid sheath. At the base of skull, it is joined by a branch from cervical plexus from C1, conveying motor fibers from C1 to spinal nerves and sensory fibers from C2. Passes inferiorly, leaving carotid sheath medial to angle of mandible, curves anteriorly to pass in the submandibular triangle to pass over hyoglossus to enter the tongue. Terminates in many branches that supply all intrinsic and extrinsic muscles of the tongue except paretoglossus. Branches gives branch to meningeal, retains to cranial cavity through hypoglossal canal, supplies dura mater. Descending branch, this has nothing to do with it, but it's from C1, it's called superior root of ansa cervicalis, leaves nerve and join posterior root of ansa cervicalis from C2, C3 to form the ansa cervicalis, which supplies infrahyoid muscle, but appears to be emerging from it, but has nothing to do with the rootlets of the original hypoglossal. Again, the nerve to thyroid and geniohyoid, which is again from C1, supply thyroid and geniohyoid muscle, leaving the hypoglossal nerve. But the terminal branches of it supply hyoglossus, genioglossus, styloglossus. These are the extrinsic muscles, and then all intrinsic muscles of the tongue. I'm done. This is the end of lecture today. We have finished with the cranial nerves. Now it seems that this will be your last lecture. No? يعني انتوا ويايا؟
نعم دكتور.
انتوا ويايا. انتوا 6 بالشهر يعني يوم الثلاثاء امتحانات عملية، راح تتوقف الدراسة مو؟
نعم.
وما تتوقف المحاضرات، تتوقف المحاضرات؟
والله صراحة دكتور ما نعرف، لكن أغلب الدكاترة خلصوا المنهج يعني وبعد ما ناخذ نظري.
لأنه هم شو اسمه قالوا أول مرة على أساس دي 10 من 10 بالشهر تبدي الامتحانات
إيه.
هسه جابوها لي 6.
اي نعم دكتور، بس 3 ثاني امتحن نستمر ما ادري شو وقت.
دقيقة. يقول تبدأ الامتحانات النهائية العملي يصير يوم 10/7 من شهر تموز، وتتوقف جميع المحاضرات الإلكترونية والحضورية من 10/7، بعدين قالوا 6/7 يعني ماكو محاضرات بعد.
تمام دكتور، يعني هذا آخر أسبوع محاضرات نظري.
هذا آخر شيء اليوم بالنسبة لي، آخر شيء آخر محاضرة. بالنسبة للامتحان النهائي اللي حديناه داخله كل المحاضرات، الشيء الوحيد اللي انه اللي الفصل الاول اللي الماده اللي امتحنتوا بها راح يجي بها كلش قليل من الاسئله، 2 أو 3 فقط، والباقي اللي ما ممتحنين به كل الاسئله راح تجي من هذا. الاسئله راح تكون single choice questions، مجموعه single choice questions او مجموعه true or false، ماكو رسومات ولا اكو شرح. كل شيء ما تسويه انت تقرا السؤال ويا 5 statements تختار واحده منهم حسب السؤال، بعدين اكو مجموعه. السؤال الثاني هو مجرد statements بس تجاوب تقراها، اذا true تكتب true، اذا false تكتب false. هذا هو الامتحان راح يكون هالشكل.
دكتور زين، دكتور سؤال.
نعم.
هسه الفصل الاول اللي اخذنا 6 محاضرات نظري، هذنيك راح يكون منهن سؤالين فقط، يعني شيء قليل يجي.
سؤالين او 3 كلش قليل يجي منهم.
والباقي يجي من يعني من المحاضره السابعه من النك للمحاضره 17
بالضبط. دي هاي اليوم اخر شيء.
هاي اخر شيء، لان انت بعد نزلت محاضرتين او 3 بعد ما درسناهن يعني.
إيه
ليش مو داخل؟
شو اسوي لكم؟ لا ما دخل باقي يعني انستيزيا ولا يعني كلينيكال ابلكيشن. شو اسوي لكم؟ ما راح
يعني اخر شيء كرانيال نيرف.
هاي اخر شيء اليوم، اخر محاضره مال اليوم.
تمام دكتور، بس شوي ساعدنا لان بالفصل الاول.
هسه الفصل الثاني دزيتوا تقارير؟
نعم دكتور.
انتم من تدزون تقارير دزوا مره واحده، مو 10 مرات تدزوا لي نفس التقرير، كل ساعه افتح وطالع نفس الاسم، كل ساعه افتح ورا يوم هم تدزون، ماكو داعي. مره واحده دزوا خلص ده يوصل لي حتى مكان ده افتحه، اي صيغه اللي تدزوا تفتحها.
احسن دكتور اخو بيخاف ما يصل يعني.
لا ما يخاف ما يصل، من ناحيه النتائج راح شو اسمه ادزوجه اللي يوم 8 بالشهر اللي ما يدز اسمه راح يكون موجود، حقول له يا بنت ما داز، ذاك الوقت يتاكد. بس اسمه مرتين و3.
تمام دكتور مشكور.
كل واحد داز لي 5، بعدين قسم منكم جاي رايح على الانترنت جايب لي فد شيء وحاطه زين، لا مصلح الاغلاط لا ما ادري شنو، لا ليش هيك؟ وقسم منكم لا زين تعب روحه وجاي ومرتب وكاتب ومحول،
دكتور ما هو تقرير كمساعدة اكو طلاب ما يعرف يسوي يعني
حبيبي
فيسوي على قدرته.
لا تعبوا روحكم شويه، اكتب انت كلمتين من روحك وبعدين سوي. عندك محاضرات يطلع من الكتاب من الانترنت من 100 مكانك، شويه بس تعب روحك حتى نعطيك درجه مال هذا.
هو زين دكتور احنا جاي نتعب عليه بس كبرامج ما اعرف نستخدم زين.
مو تنقلوا لي ما تعرفون تنقلون همين، يا ريت لو تنقلون عدل، نقلوا عدل اقل.
ان شاء الله دكتور ان شاء الله. تمام دكتور.
هو جدول الامتحانات ما طالع بعد، بعد ما تعرفون شو وقت النظري يعني، بس العملي محددين.
بلي نزلوا الجدول
مال النظري؟
ايه.
شو وقت الامتحان النهائي بدي نظري؟
يمكن يوم 25 اول امتحان اعتقد.
انت تقول نزلوا الجدول شنو يمكن؟
اي لا مو دكتور الجدول هسه ما ندري وين، مو بالقناه العامه نزلوه يعني الجامعه نزلت كل الاقسام نزلت الجداول الجامعه يعني الرسميه، فشفت الجدول ذاك اليوم نزلوه اعتقد اول امتحان له قبل الاخير. اخير امتحان؟
لا دكتور الامتحان شهر الثامن.
مال اناتومي؟
اي دكتور.
يما بعد بشهر الثامن.
اي والله دكتور وكل هذا وما راح نجاوب لان صعب.
ليش ما تجاوب؟ اقرا وتجاوب. اذا ما تقرا
والله دكتور جاي نقرا بس والله اسئله صعبه يعني ما
اذا ما تقرا ما تجاوب، اللي يقرا يجاوب، اللي ما يقرا ما يجاوب.
اسئلته كلها بالشابه يعني ما تعرف هذا من هذا.
في الشابه شنو؟
دكتور تجيب لنا يعني شيء والله صعب صراحه.
اجيب لكم شيء من المحاضرات مالتي يعني، خارج المحاضرات يجوا سؤال او سؤالين من خارج المحاضرات والباقي كله من المحاضرات.
دكتور احذف لنا اخير محاضرتين. اخير محاضرتين احذف
ابني ماكو يجي شيء. انتوا بعد ما مكملين المنهج تريد بعد احذف؟ تمام معكم سؤال؟
لا دكتور بس اريد شوي مساعدتك لان حتى العملي حضوري فشوي اريد مساعدتك وجزاك الله خير.
العملي حضوري يعني شنو؟ هسه اساعدكم بالتقارير ما عندي مشكله، هاي اعطيكم كلكم درجات زينه بس شويه كتبوا هيك يشبه التقرير. تمام؟
ماشي دكتور.
يلا جود لك.
شكرا جزيلا دكتور بارك الله بك.
مع السلامه.